Hi, welcome to Healthy Living. This month, the month of November when we're filming, is National Hospice and Palliative Care Month. So here at St. Tammany Health System, we have an excellent hospice and palliative care team, and I brought some of those members with me today to talk about all the things that we have going on, what you can do, how you can get those services, and how you and your family can benefit from what we offer. So my first guest is Emily Pupo.
Well,
Emily's been here before. Thank you, Emily, for coming.
Thanks for having me back.
Yeah, she is our palliative medicine supervisor.
Mm-hmm.
So tell us first, before we start talking about, getting into the nitty-gritty of palliative care, tell us a little bit about you and what you do for the health system.
Yeah, so I've been with St. Tammany going on 7 years now, but I'm the supervisor of palliative care, as you said, and I supervise nurse practitioners. We have a physician as well, nurses and social workers, and our goal is to just help manage patient symptoms while they're tackling a serious illness. We want them to know they are not alone.
Good. That's a good definition. And when we talk about palliative care, we were talking about this before we came on camera. Often people interchange palliative care and hospice, and while we do offer both of those service lines, there is a nuance to each of them that makes them different. So can you talk about that?
Yeah, absolutely. So palliative care and hospice, the difference between the two, the biggest difference is that with palliative care, you can still seek treatment, you can still go to the doctor, you can still go to the emergency room, hospital even, get your chemo, whereas with hospice, the goal is more comfort. Being at home, with your family, you're no longer seeking treatment. You don't want any more chemo, and you just want to be at home with your family. And so that's the biggest difference. But with palliative care, we walk along with you from time of diagnosis to when it's time to hand off to hospice. And then we step back and let the hospice team with their expertise handle the rest.
Gotcha. So we've talked before about how palliative care really is a form of supportive care, and it is for people who have a terminal illness, and it's also for people who have a chronic illness. Right. So can you kind of explain how that works? Why would someone seek palliative care, whether they have a terminal illness diagnosis or a chronic condition that they're living with?
So with a terminal illness, sometimes cancer that's incurable, things like that, and with a chronic illness, or some say life-limiting serious illness, we want patients to know that it doesn't have to be life-limiting, and it doesn't have to be uncomfortable. So really, with serious illness, chronic conditions, congestive heart failure is an example, COPD, Alzheimer's, dementia, cancers, things like that, we can help manage those symptoms: shortness of breath, anxiety, depression, agitation, cancer-related pain. And our goal is to also offer support for them and the family, help with coping, education on the disease process, and really understand what is to come and help them live a longer life, but have quality with that.
Right. So for instance, my own mother, she has congestive heart failure. She was diagnosed years ago. How would she implement palliative care into her care? Who would she start with?
So we actually have a lot of patients that will just call our clinic and ask us the same question: how do I get in with you guys? Yeah. But simply ask her cardiologist or her primary care doctor for a referral. And of course, if they get pushback for any reason, we always tell them to give us a call, and normally it's education. But how we would help her, for example, would be the shortness of breath. Along with shortness of breath comes anxiety. With anxiety comes depression. Right. Those are symptoms that we can help with CHF, or congestive heart failure. Right. And then there's also edema in the legs, different other symptoms like that. But the anxiety, depression, shortness of breath are the three main ones. But all you have to do is ask your provider. I know St. Tammany Health System has a palliative care, and there are other palliative cares that are conjoined with a hospice that aren't with St. Tammany. But I recommend asking your physician, and I also recommend talking with family and friends. A lot of family and friends, know people who know people who know people. Right. So they'll be able to help as well. And when you say we can help you with this or that or the other, what do you mean? What is the help? Yeah. So of course, there's medications. There's medications such as low-dose morphine. Really small low-dose morphine really helps relax the body and has great success with preventing shortness of breath and, and comforting the shortness of breath. And there's other techniques. We teach breathing techniques. We also have a social worker that offers support and how to cope when an attack, for example, a shortness of breath attack or anxiety happens. There's also just education. Whenever you don't know what to expect and the unexpected happens, it makes it worse, right? So whenever you're educated and you know what to expect and what's going to happen, it doesn't make it as bad and as scary.
Right. So Emily is all about continuing education and educating everybody, all of our colleagues, on palliative care, which is so smart. So I watched a couple of videos that you sent me links to last year, and one in particular was a breast cancer survivor. The woman had been living with breast cancer, I want to say like 17 years. But she was a seamstress, and the treatment left her with neuropathy in her fingertips. And her testimony was basically that palliative care allowed her to get back to doing what she loved. So in that instance, that's basically a medication, right?
So with the neuropathy, you know, the nerves in your fingers, there's different medications that can assist with that. There's also, you know, different techniques. There's compression, you know, sleeves for your arms as well. There's a lot of different techniques that can help with that, physical therapy. And that's kind of our goal. So that patient's goal, for example, was I just want to get back to seamstressing, I guess is the way you say it. But we have patients that have even simpler goals. I just want to be able to walk outside and sit on my porch in my rocking chair without being short of breath. I just want to be able to hold my grandkid and not hurt. You know, so some people that seems, you know, oh, that's not a big deal. But when it's taken from you, it matters more than anything else. So our goal is to help patients achieve their quality of life and their goals, whatever those are.
Okay, that's good. That's a good way to put it. And that, to me, kind of puts it in a nutshell for people. You have another kind of goal of the care that you provide, and you and I have talked about this a lot, and you call this the best gift that a family member can give to another family member, and that's advanced care planning. So first of all, why is that important, number one, and then how do you go about it through our palliative care team?
So perfect timing. So again, this is November, but it will be airing, I'm assuming, around
early, like in the next couple of weeks.
Yeah, the next couple of weeks. So December. So Christmas. So the best gift to give your family is the knowledge of knowing your wishes. So advanced care planning, there's different levels: living wills, healthcare power of attorney, advanced directives, and then a LaPost as well, which is a physician's order for scope of treatment. And these are basically different documents that you can document who you would want to make your medical decisions if you're unable to speak for yourself, if you would want chest compressions, intubation, feeding tube, really spells it out in depth, and then that way there's no guessing. You know, hypothetically, your daughter doesn't have to guess, would mom want this? I'm not sure, I don't know, and then they have to live with that decision. So this Christmas, you know, maybe give the gifts when everyone's opening presents. It's not a fun topic, but you could, you know, hey, if something happens to me, I want you to know what I want so you don't have to worry about it ever again.
Peace of mind.
Peace of mind. And we have plenty of events. We're going to be announcing our 2025 series soon, that we do ACP events every month where we'll complete the documents for free for patients and their families. You know, a lot of times we'll have a spouse, and then all of a sudden the other spouse will be, hey, I'm going to do this too while I'm at this appointment. Like, come on. And we're also, our goal is to be in the community, and any doctor you talk to can help you with that, but you can always reach us at Palliative Care as well.
Okay. So let me ask you one last question before I let you go. What is it that you love about what you do?
That's a tough question. There's a lot. So there are tough days, but the tough days are few and far between, and what really makes me love this job is when a patient or a patient's family member, we're in a thankless job, right? As nurses, as healthcare, it's not always we don't always get thanks. And so our thanks is that patients, you know, achieve their goals and get what they need. So when a patient's able to call us and they're able to say, I think I'm ready for hospice now, I feel good about my decision, it makes me so happy I could cry, because they're prepared, we've walked it with them, they trust us, and they're able to say, I'm ready now. And they're able to make that decision, and it's not thrown upon them or scary. And I just love my team as well. You know, each person in palliative care, it's personal to them. I know we've talked about my mom before and how palliative care helped me make those decisions for her, because I was in that situation and we hadn't talked about it before, so I really struggled with that. And just helping patients have a good quality of life, achieve their goals, whatever those goals are, and achieve a good death, whatever that death is. If it's fighting to the end, if it's at home with their grandkids, whatever it is, we just want patients to know we're here for them, we hear them, we're walking the path with them, and we can also help them get to wherever they want to be.
Great. Well, thank you so much. Thanks for sharing all the information, and thanks for sharing your heart with us. Is there anything else you want to add?
I would just like to add that if you aren't sure who to talk to about advanced care planning, just call me. Our number is 985-871-5975.
Okay.
And if you come to the hospital and ask for the girl in palliative care that talks about ACP, everyone will know where to send you.
All right. Thank you, Emily.
Thank you.
And thank you for staying with us. We will be right back with our next guest.